Yeah, from Little Kim, the Queen Bee. It's ladies' night, what? It must be Angie on the mic. The butter pea, honey, got the sugar, got the spice. Roll the L tight, keep the rhymes right, yo. I just made this motherfucker up last night. And I'm the rookie on this all-star team. Me and Kim is getting cream, like Thelma and Louise, but on chrome. Never leave that Brooklyn shit alone. So if you say it's on, then it's on. Bang this in your whips, back them cold roly with the chips in the wrist. Here's a French kiss, I dismiss all you chicks. Spit 6 from the 4th, 5th, make it dance. Ow! I stay focused, and the dope is like a penny with the hole in it.
Hello and welcome. This is Ladies Night on ITV. My name is Ameze Obai Siagbon. It's of course a delight to have you join us each and every time on the show. Alrighty, like I always say, we have a beautiful topic, an interesting topic to talk about today. Today is no different. We're going to be looking at breast cancer. Actually, the month of October is Breast Cancer Month. Breast Cancer Awareness Month is a month where they create awareness on the prevention and the possible care of cancer patients, especially breast cancer patients. And that's what we're going to be talking about today. Of course, I'm not alone in the studio. I have my regular faces in the studio. I have the ever-glowing C. White. I also have Mama P. And today I have a special guest who will actually talk to us about breast cancer, all we need to know about breast cancer. I have in the person of Dr. Amy Lomo Abode. Thank you so much for joining us on the program today.
Thank you, Ms.
It's a delight to have you. Alrighty, now yes, like I said, we have a special guest, and so she's going to be the one talking to us a lot. We have so many questions already. I'm sure people like Mama P have a pile of questions waiting just to bombard the doctor today. So I'm going to let us start off with what is breast cancer. Most people out there know already, but a lot of people don't. So we're going to be starting with that. What exactly is breast cancer?
Okay, thank you, Ms. Ameze, for having me. Good evening, everyone. Yes, breast cancer is a subset of breast tumors that occur from different cells that can be found within the breast tissue. The most common set of cells that they arise from are called the epithelial cells, and these epithelial cells basically include the ducts and the lobes. Yes, okay. That's what breast cancer is generally.
When you say ducts and lobes, you know some of our viewers and even some of us seated here don't even know what you're saying.
Please don't call my name.
I didn't call any names. So what exactly are the ducts and the lobes? Just try to break it down a little for us.
All right, okay. So if you look at the breast, which is the mammary gland, you see that it's a structure that is found on the chest wall. That's right in front of us.
Yes.
I'm sure we can understand that. So underneath this structure is basically made up of fat and the skin overlying it. Within it is the actual gland, the actual breast itself, where you have ducts and the lobules. The lobules are where milk is produced, and then they come out through ducts. So those are the two main parts of the breast. And then you have stroma. That's the things that connect them together, that keep them together. And then you have the ligaments that suspend the breast tissue to the chest wall. But covering all of this is what we see outside as just the skin and basically fatty tissue. Yes.
Okay, so the breast cancer is the lump that affects those parts of the breast.
Yes, breast cancer is when either okay, let me put it this way. When any part of the breast, like all the structures I just mentioned, when any of the cells that make up these structures start having abnormal proliferations, yes.
Okay, when you say proliferations,
okay,
holes or what exactly? Most people out there are not privy to this information, so we need to kind of like break it down so we all understand.
I'm sorry, I apologize. Okay, I'll do my best to do that. What I mean is, it grows out of its original location where the tissues, the way it's normally supposed to be. Some cells can become altered at the genetic level. That's at the way cells are supposed to behave. Somehow they stop behaving like that and start going on their own paths. And so this just disrupts the normal function of the breast. Yes.
Okay. So what are the possible causes of breast cancer?
Okay, breast cancer, like I've said, is when the cells start acting abnormally. So the issue now comes to where there are risk factors that now influence which cells start changing or start acting abnormally. Basically, the cause is that the cells just start acting abnormally. What we should focus on are the risk factors. Okay, so these risk factors, we now have the modifiable risk factors and non-modifiable risk factors. And what I mean by non-modifiable, I would like to start with that. These are risk factors that we can't change. We just were born with that factor. Yes, so you have age. Increasing age increases the risk of breast cancer, increase the risk of breast cancer. You have increasing incidence of breast cancer in women that are aged above 50. I mean, worldwide, the prevalence is about one case in 100,000 women between 20 and 21 years of age. But by the time you start looking at statistics of women that are aged 50 to 70, you start seeing almost about 462 cases per 100,000 women. So age is just a natural risk factor for breast cancer. And then another non-modifiable risk factor is gender. Females were more predisposed to having breast cancer. This means that I can call in men. Hello? Okay, so females, why? Because we are constantly exposed to cyclical hormones. Yes, we menstruate, estrogen is there, progesterone is there. So the constant exposure of the breast tissue to these hormones naturally predisposes females to having breast cancer. And it has also made breast cancer the leading cause of death amongst cancer deaths in women. Yes, it's the leading cause of cancer deaths amongst women. Then the last non-modifiable risk factor is our genes. Some people have the popular gene called BRCA1, is colloquially called BRCA1 or BRCA2. Yes, and then people that have a strong family history of breast cancer or even ovarian cancer, because they found a link between them. Yes, if you have a first-degree relative, that's what I mean by first-degree relatives, that's someone in your nuclear family, maybe your mother or your sister that has breast cancer or ovarian cancer, or even both. Or if you personally...
Wait, so someone can have breast cancer and have ovarian cancer?
Exactly.
Wow.
Yes, can have both. So this increases the risk of having breast cancer, and there's nothing you can do about those. But for the modifiable risk factors, which are things that we can actually influence, I can simply categorize them into hormonal factors, lifestyle factors, and environmental factors. Yes, so for hormonal factors, the main mechanism is just the fact that a woman is exposed to hormones for a long period of time. So everything I'm going to be mentioning after is based on the fact that you are exposed to hormones for a long period of time.
Hormones in your body?
Yes, our natural occurring hormones. That's the popular estrogen and progesterone. So you have women that attain menarche at an early age. That's people that start menstruating early, because if you start very early, that means you're going to have a longer period of menstruating, which equals to a longer period of estrogen and progesterone interplay. Then you also have women that attain menopause late, so you can see how prolonged exposure to it affects it. You also have women that are nulliparous. That's women that have never conceived, have never put to bed, yes, because they never get the chance to get that abrupt stop in the menstrual cycle. Also, women that take in late. These are not absolute too, they are just risk factors, yes, based on studies and statistics. So that's for the hormonal factors. Then we have the lifestyle factors, yes. So people that have poor diets, westernized diet. In fact, cases of breast cancer increased in Africa as we adopted the westernized form of diet that's taking more of saturated fats, sedentary lifestyle, not exercising, eating the wrong food. and also people that are obese. Obesity is basically having a BMI of greater than 30, and it's easy for anyone to calculate it. It's just your weight over your height in meters squared. Yes, that's how to get your BMI. So if you fall above 30, that means you're obese, so you should try and work on it. The normal BMI is 18.5 to 25. So you should naturally be within that range.
Okay.
And for the environmental factors, passive smoking and active smoking. Passive smoking means even if you are not the one
Someone else
smoking,
smoking around you.
exactly.
Okay.
So you should also avoid areas where people smoke a lot. And then radiation, that's why if you go for an X-ray, they'll usually put a lead cover over the chest region, especially for women, because exposure to radiation is also a risk factor for having breast cancer, and also exposure to pesticides. So that means you should go for healthier sources of our foods, and that's basically.
Wow, that's a whole lot, seriously speaking.
Okay, not too much.
No, not too much. We're still getting started. We're just getting started, rather.
Okay.
I don't know, my other ladies, do you have questions? I was trying to signal Mama P and she did like, I'm listening, please don't disturb me.
I actually wanted to listen to her because, you know, some of these things we don't really know them.
Yes.
Even when we know them, we don't really know the risk factors attached to it. And yeah, I would love to ask this particular person. I know she would have something to tell us more, but let me just really drop this question probably before I forget. When we talk about breast cancer, you know, they also say that some kind of discharge is related to breast cancer. Now, and I asked a doctor friend back then when I got to hear people say about that breast discharge, and they say they have yellowish, something that some are greenish, transparent, water-like, and all that. So my question is, how do they know the particular one that's related to breast cancer?
Wait, are you supposed to even have discharge unless you're actually breastfeeding? Like, is anything supposed to be coming out from your breast?
Okay, let me start with her question.
Yes.
Actually, the discharge that is associated with breast cancer is usually brownish to bloody.
Okay.
It's usually is bloody or brownish.
Okay.
And you are ideally not supposed to have any discharge at all, even if it's clear. You're not supposed to have any discharge at all. But for the other variants of discharge, that is yellowish, greenish, they are indicators of other forms of breast pathology. Yes,
Okay.
but not usually breast cancer.
All right, and I also hear people saying that, like you just said, we are ideally we are not supposed to have any discharge as a woman, but eventually if it happens, I also hear people saying that the chances of that person giving birth is very slim. Is that true?
Well, we're diverting a little, but
No, right? Because it's
yes, I understand your concern because what's the commonest reason for discharge is usually when women have a high prolactin level, which is known as hyperprolactinemia, because prolactin is a hormone that is actually supposed to be a lot when you are breastfeeding, not when you've not taken in or you're not breastfeeding. So prolactin as a hormone naturally inhibits the normal hormones that are supposed to assist in you getting pregnant, that's estrogen and progesterone. So when there's a high level of prolactin, it makes a woman to have a milkish, whitish discharge, or sometimes it might just even be clear, because that means prolactin is the hormone that helps the breast to produce milk. So if the breast is even producing anything at all, usually, not all the time, medicine never say never, usually prolactin is what is causing that. And when a woman has high prolactin levels, the chances of taking in are reduced. Some people have
their hands,
just, you know,
flappy.
general fat distribution,
Yeah.
which you can still. Some people, they just put on weight on the upper part.
We don't know who-
or face.
We don't know who we
Yeah, so-
offended. We in that category. We don't.
I don't know. So you can't really say you might now achieve the breast size you want, but you can't say whether that same fat will go to. You can't just the way people say when you are losing weight, if you want to lose belly fat, you can't just say it's only belly you're
You
going to
lose
lose
completely.
it. Yes, you lose completely. So it's the
Yes.
same thing with putting on weight so that your breast can look bigger. So most times people just do surgery because that way they can just directly channel
Focus
the
on
fat
to the
or
right
whatever,
places.
you want them.
material they need to use to increase the size of the breast
Okay.
cosmetically. Yes.
Well, talking about the surgery, it's a no-go area for those people who want to, because I don't understand the way the Empress is smiling and the way she's bending her neck.
Please,
and
the
looking
doctor
at me.
says be happy.
And I'm
trying my best
I don't
to do
get
that.
it. You want to start the happiness here?
Yes?
No, you have to wait after the program. You
No,
can start.
start now.
Emperor, you've been smiling.
I don't
If you
get
have
it.
plans, carry us along.
There are no plans. I'm just
It's the
waiting for the
50s.
thing you promised us. Anyways, we've been talking about breast cancer right here on Ladies Night. In case you're just tuning in, you've kind of missed a lot, but we'll still have a lot to talk about, so you definitely will benefit from all that. I have Dr. Emilomo Abode in the building. I've got Mama P, and of course, the ever-glowing C White right here. My name is Ameze Obaisegwan. We'll take a short break, and when we get back, we've got more for you. Don't go anywhere. Welcome back. This is still Ladies Night right here on Independent Television. My name is Ameze Obaisegwan. Of course, you can call me the Empress of the Airwaves. I still have my beautiful ladies right here, and of course, my special guest on the show tonight. I've got Dr. Emilomo Abode. Of course, she's our special guest, and I have Mama P, the controversial Miss Natural, and yes, we made a little change. I've got MJ. She actually kicked C White out, so she's going to be here right now. How are you doing, MJ?
Well, I'm fine.
I know you've been backstage watching and listening, so you have a lot of
Yes,
questions
and
probably.
you guys have been cracking me up.
I'm glad. Okay, so I want you to just bear your mind now. I know you have some questions bothering you that you want the doctor to actually answer or address, so you can just go ahead now and do
Okay.
that.
Just one anyways, because
Okay.
you guys have really said a lot, so there is no need to be going back and forth. So doctor, my question is, what does exercise has to do with preventing breast cancer? Because I saw it online while I was reading and researching for this program, that if women that exercise 4 times weekly actually have lower risk of having breast cancer. So how true is that?
Okay, thank you for your question, because
You're welcome.
this exercising directly reduces this risk factor that I mentioned under lifestyle, which is obesity. And yes, obesity, because it's recommended for the average human to exercise at least 4 times a week. In fact, some books will tell you at least 5 times a week, the duration of 30 minutes. Yes, because sedentary lifestyle is a risk factor for having breast cancer. And this is because, I don't want to go into the gory details, obesity, if you're not exercising, you have tendency to gain weight. That's the honest truth. So weight gain increases the amount of insulin that is in the system, and this hormone directly messes up the hormones in a female. So it's going to, how will I put it now? It's going to, increase the chances of someone having breast cancer, because the breast tissue is going to be exposed to like haywire hormones. Cortisol, insulin, they all cause a lot of hormonal imbalance and havoc in the female body. So exercise definitely helps to reduce the chances of having
Okay,
breast
my
cancer.
last question, still on exercise. I don't know
Okay.
if most persons know that there is anything like breast reduction exercise. Yes,
Okay.
breast reduction. So what do you have to say? Does that have any after effect or side effect leading to breast cancer?
No, it doesn't. Breast reduction exercises is just basically, maybe you are focusing because under exercise you also have toning exercises. Maybe you decide to pay more attention to your legs or your arms or your chest. So it basically just focuses on losing the fat around the chest region, which now interprets into the breast size reducing. Yes, because the fat around the chest region reduces. So it doesn't increase the chances of having breast cancer.
I'm just hearing about this breast reduction exercises. I wanted to ask also, the breast, is there a breast firming exercise or breast enlargement exercise? Who just said me? No, we have to, please host, ask who just said me. Someone just said, no. Why are all my questions?
No, because I'm wondering why you're asking. Do you need to increase the size of yours?
Is there a problem if I want to increase the
What
size
are you
of
increasing?
No, because I know
People are trying to get to your level and you are trying to overtake.
Let me flaunt a bit. Please, question number 2. Is there an exercise to do to increase the boobs? Ignore every other thing you hear, just the question.
It's okay.
Or they said, I remember there's one exercise they said if you keep doing it, I've been doing it a while. I don't know how long, and if there's an exercise, how long does it take before you start seeing results? Well, this is the most important part to Ms. Ma.
Okay, well, I'm not a fitness specialist, first of all, disclaimer. Okay, but basically what happens is when you exercise, because this breast tissue is resting on a muscle. Yes,
okay.
It's resting on the muscle, pectoralis major, that's the name of the muscle. So when you do exercises that strengthen that muscle, it's just like guys who, that same muscle, guys have it, it's just that their own, it's flat now. It's because our own mammary gland is more advanced. That's why it comes out as boobs. But every one of us has that muscle. So when you exercise, that muscle becomes more, toned or, bulkier. So it might just...
That's why you see guys that exercise with pump
Exactly,
chest.
they have a bulky.
So we can
So if you do
attach
that
with
to
what
that
they are
muscle
doing.
under, exactly, it just pushes the
It's
breast.
so nice to meet
Mama
you today,
P, really.
Ma.
Thank you, you too.
We don't know whether your own type of body is the type that distributes fats
my
in
body
other
will
parts of
answer.
the body.
Definitely, if you can
The Bible
reduce
say whatever
it.
we
So
say.
it's not everything you see
Yeah.
that you should do.
Oh my! And also, a funny question though, please. In your field of study, is there is there a place of family problem? Like there are some cases you don't know where it's coming from. No, these are things that.
Okay,
we
this should
say-
be your last question.
Yes.
No, this will
Go
be my
ahead.
last question, and it's very important. I don't want to say spiritual matters.
Okay.
You understand what you're calling a family problem?
Okay,
Is there a
family
place
problem.
of family problem in your study? Have you seen cases where there's no gene? You said gene hereditary.
Yes.
There's no hereditary
Yes.
relation. It's not come. The
Factors.
person lives a healthy life,
Yeah.
and then person just tell them say you go see, and before you know, the person is having cancer. Do you people see? I know medicine. They say people don't believe in it, but do people see such cases that inside your mind you just know this thing guy be.
Well, the way we say that is by saying never say never in medicine.
Okay.
Exactly. So it can just happen to
And even the
someone.
doctors are shocked.
Well, why we can't be shocked, because we know that never say never in medicine.
Like anything can happen.
Anything can happen. But the thing is, these risk factors I mentioned, you can't really, when you are evaluating the patient, you don't know at what point, the patient was exposed to one of these, even in the slightest, amounts.
Okay.
Because even under the environmental factors, like I said, you have radiation. I think I didn't mention charred meat. That's all this body that we eat. So I'm telling you, charred meat, charred food. Yes. So you don't know at what point the patient was.
As in all those roasted bullet that we eat.
I'm telling you, it hurts me too. Really.
Interview Mama P. Please.
Hope it doesn't involve
off
boiled
the
corn.
camera interview.
The one
No,
charred.
not boiled, just charred.
Okay,
Yes.
roasted corn.
Yes.
Roasted corn.
Yes.
Wow.
So apart from that's when it's charred. You can roast it, but it doesn't have to start having, the charred buns.
The buns, yes.
Okay.
Yes, or being roasted with charcoal. You better to use the grills, because those things contain carcinogens. That's the honest truth.
That exposes you or gives you the high chances
Chances of now carcinogens. There are things that if if the person is exposed to it, the cells can now change to cancer cells.
Okay,
Then
now
up
still
I
on
think-
food.
okay.
I think this should be the last question. No one else has a question, right?
No.
But
No,
even
fam-
apart from
I've-
that, too, some
Hallelujah.
people can just, like you
No,
said,
I've
it might be spiritual.
Yeah, that's what I'm saying
Family
now.
problems,
Family
sorry,
problem.
but-
She,
Oh, village
no,
people.
she has been able to explain to me that village people or family problems is what they call it. We never say never. You understand? When they see that kind of thing, they'll be like, no. So
That you
this
put
is
it that way.
Okay, now still talking food. Are there foods or fruits? Because I hear a lot of people say fruits are very good
Yes.
for protection of any kind of disease or
Yes.
sickness. So
Yes.
are there foods or fruits or even drugs that we can take just to reduce the risk factors towards getting breast
Breast
cancer or cancer in general?
Yes, all right, thank you so much. Cancer happens when you're exposed to carcinogens, and carcinogens are related to all the risk factors that I mentioned. So what we can do, like I said, poor diet is a risk factor for breast cancer. What you can do is to increase the amount of antioxidants in your body, because when you have a lot of free radicals, they are like poison in the body. So they cause a lot of havoc. And
I'm sorry, please, what do you
can-
mean by antioxidants?
yes, that's
What are they exactly?
Yes, antioxidants, they are, how will I put it now? Should I say molecules that reduce the oxidative stress in the body?
Bigger grammar.
Sorry, let me break it down. They basically deal with the, let me say poison. Yes, let me call the free radicals poison.
Okay.
Yes, they like go down like, hey, I catch you, and they dilute it. Like they nullify the effect of the free radicals. And antioxidants are found in fruits. That's when you have your vitamin C, your vitamin E, your vitamin A. So that's where a good diet helps in preventing the risk of breast cancer. So yes, you have to take fruits, healthy fats, fats from fish. I love fish. Disclaimer. So yes, healthy fat, because they contain mono unsaturated. That's fats that are unsaturated. You have mono unsaturated, polyunsaturated. You find them in fish. That's the omega-3 fatty acids, palm oil. So all these help to reduce the oxidative stress on the body. That's the amount of free radicals that are in the body. And because these free radicals, like I said, they are poison, and they can influence the chances of a person having breast cancer. So yes.
Wow. So take a lot of fruits.
Yes, take a lot of fruits.
All right, and
Healthy
good
diet,
fats.
yes. For those that know the Mediterranean diet, yes. That's just
Seafood.
people that are, yes, seafood.
Seafood.
Yes,
Yeah, and
Very
Mediterranean people
expensive
take a lot of
and
seafood.
very annoying. It's okay. We'll try it.
She just mentioned fish.
No,
Fish.
no, when I went to
Eggs.
Crayfish,
when-
100 naira.
seafood,
Eggs.
eggs.
No, it's not all fish.
Chicken.
Fish.
No,
with
the
good
food,
fat.
the Mediterranean food.
Well, I don't
No,
know
they only
crayfish
like-
and
No,
Yeah.
all
no
fish.
fish.
Buy
All
seafood.
fish.
Yes, you don't have to go for the expensive seafoods. No.
You don't have to go
just
for
stick to your
prawns.
fish.
Oh, you know what I was
Like you
going
see
to say.
Yes.
Don't look at Instagram
Yes.
Indomie.
Avoid red meats. Yes. cow
Instagram
meat.
Indomie. I
Avoid
tried
red
it
meats.
and it came out.
That's what
bad.
I'm trying to say. So, anyways, thank you so much, Dr. Imloma Abode,
Thank you for having me.
being here on the show and for enlightening us. Like, we've learned a lot. I know Mama P is smiling. She was really tense at the beginning because she's like, I don't know what to say. But I know definitely you've had a lot of things to say today and you've been able to learn a lot. Same thing goes for MJ, who is, I don't know, probably you're trying to store everything in your brain right now. And for CY, shout out to you as well. Sorry, we couldn't accommodate everyone on the stage today. My name is Ameze Obai Siagwan. It's been a delight having you join us today on the program Ladies Night. We'll be here again next time, so of course do well to join us because we always have something interesting to talk about. Have a beautiful night rest.
Yeah, from Little Kim, the Queen Bee. It's ladies' night, what? It must be Angie on the mic. The butter pea, honey, got the sugar, got the spice. Roll the L tight, keep the rhymes right, yo. I just straight this motherfucker up last night. And I'm the rookie on this all-star team. Me and Kim is